finger.
So, ladies and gentlemen, this is Jen explaining the digestive system. Let's begin.
Alright, so we have the salivary glands first. We have the parotid gland right next to the ear. We have the sublingual gland, which is underneath the tongue. The submandibular gland. We have the tongue here. We have the esophagus, which is posterior to the larynx. And then we have, this goes all the way down to the stomach. So
Please hold for stomach model.
we have our, okay, this is the serosa, the outside of the stomach. And then if you have to go to this model to see, this is the longitudinal muscularis, this is circular muscularis, and this is oblique muscularis right here. And then you have your greater curvature, which is, this is the greater curvature, this is the lesser curvature, and on this model it's the same. This is the greater curvature, this is the lesser curvature. And then you have where your esophagus meets the stomach, you have your cardia, and then you have the fundus, there's this area here, and then you have the pylorus, you have the pyloric antrum, which is this area here, the pyloric canal, and the pyloric sphincter, which leads to the small intestine. And this is the duodenum, and then you have, so the small intestine, so you have your, and then you have, the jejunum is the second part of the small intestine. I guess this is the jejunum, and then this is the ileum right here. And then you have, it leads to the large intestine, which you have your cecum. This is the appendix, and then you have your ascending colon, you have your hepatic flexure where the liver meets the ascending colon and it turns into the transverse colon, and then you have your splenic flexure where the spleen meets the large intestine and it curves down to the descending colon, and then around to the sigmoid, and then to the rectum, and then to the anus. And then you have, this is the model of the inside of the small intestine. You have the simple columnar epithelium. You have these blue dots, which are goblet cells. You have the lamina propria, which is gray. You have the central lacteal or arterial. I think this is the central lacteal, this green right here. Then you have the intestinal crypt, which is right here. You have the Paneth cell, which is this red cell right here. You have the mucosa, which is over here. You have the Brunner's gland, and then you have the muscularis.
Which one is the mucosa again? I'm sorry.
The mucosa is, I think it leads, it's on the side. It leads, the Brunner's gland leads into the mucosa over here. So this is the muscularis mucosa, this pink band right here. And then you have your lymph follicle, which is the Peyer's, which is this big blue follicle right here. You have your submucosal plexus, which is yellow, these yellow nerves right here. And then you have the serosa, which is, oh wait, no wait, we missed. We have the muscularis is over here, this segment over here. You have your longitudinal layer, you have your circular muscles over here, you have your myenteric plexus, which is the yellow over here, and then the serosa is the outer layer of the small intestine. And then we go on to the liver. You have your the liver, you have your right and left lobes, your right lobe of the liver, your left lobe of the liver. This is the falciform ligament right here. This white part on the posterior side of the liver is the round ligament. And then you have your hepatic duct, which is this green here. You have your right hepatic duct your left hepatic duct, your common hepatic duct is where they meet, and then you have your cystic duct is right here, the gallbladder is right here, this green, and the common bile duct is the top right here. And then we have, that's it for the liver. And then we go on to the pancreas. Ask them where the duodenal ampulla is. The duodenal ampulla we think is right over. Do you know where the duodenal ampulla is? Is it right over here?
Having some technical difficulties.
Sorry,
duodenal
ampulla.
Please
Okay,
hold.
so this is the duodenum and this is the pancreas. This is the head of the pancreas, this is the body of the pancreas, and this is the tail of the pancreas where it meets the spleen. And then you have your lobules of the pancreas, and you have your pancreatic duct. You have your accessory pancreatic duct, which is the top white part right here, and then you have your principal pancreatic duct, which is the bottom portion over here. And then that's it. You have your lobules of the pancreas, and we're done. Done.
Take a round of applause for Jen, everyone.
Please don't show my face.
What about it? You didn't do that?